a little bit about how your technology works and how it's being used right now and used differently than it normally is used with so many folks working from home.
Absolutely. So we're a big data platform. Our motto is that we aim to bring data to every question, decision, and action. And particularly in this time frame, we really believe that data can save lives. We gather data from a huge array of sources and find ways to make sense of it. Right now, as a simple example for anyone out there, we've got a whole bunch of public-facing dashboards from that help articulate what's going on with COVID-19. There's over 120,000 users interacting with these. Even more importantly, we're working with private and public organizations who touch every angle of this crisis to help with very tactical things like ensuring that the virtual workers can go virtual and that they've got secure connections when they go virtual, to more foundational work with medical suppliers, hospital systems, logistics and transportation companies, manufacturers, all the fun federal, state, and local agencies that surround these, so that they can get visibility on the different aspects of not just what their employees are doing safely in a virtual environment or safely in an essential work environment, but so that they can get that insight that data brings that will help drive the right actions, fundamental decisions to save lives in this crazy time that we're in right now.
So are you saying that all this data was there and the U.S. government didn't act on it or didn't know how to find it or analyze it?
Yeah, I think there are two things going on simultaneously. When you look at the huge array of organizations that would be involved in something like a pandemic, even at the federal level, there's 10, 15 different distinct organizations that would touch a pandemic. And one aspect is, are they effective in driving a fulsome set of data for their own unique needs? Health and Human Services, CDC, FDA, FEMA as examples. Then the second piece, which is, and then they've got some degree of digitization happening, but not always as much as they would want to or need to. And then the second, even more thorny issue is those data repositories are isolated, which is the case with so many of the Splunk use cases that we drive. And how do you do an effective job of synthesizing the data, correlating and finding patterns across that data? Because the chain is only as strong as its weakest link, as one of those throwaway sayings goes. And for simple example, if we can just imagine a hospital that through heroic effort has actually got adequate doctors, nurses, technicians, beds, ventilators, PPE, everything they need, but they're missing cotton swabs, all of a sudden they're in a very difficult situation. So it really comes back to huge amounts of data available, a lot of it misunderstood, a lot of it dark, but if you can surface it effectively, it saves lives and helps organizations with data-driven leadership.